a doctor who's going to walk you through that. How many here get your blood drawn annually? Raise your hand. Yeah! That's great. I had prostate cancer. The only way I found out about it is through my blood work. And they drew my blood, like your PSA's very low. But you do it every year, and it goes from 2 to 2.5 to 2.5 to 3. And because of that, I went for a biopsy. They found out I had prostate cancer. They removed it. I'm cancer-free, and the landing gear works, which is great. It's important. My dad died at 79 of prostate cancer, and so few people take their health they take it for granted. You think you're 25, 35, and you don't have issues. But if you stay on top of it, you're going to live a much better life. So Sean Cahill, Dr. Sean Cahill, is a 15-year resident of Hinsdale with his wife and 3 teenage kids. His kids attended St. Isaac's. His oldest graduated Hinsdale Central, is a freshman at Auburn, and he has 2 kids at Fenwick. His middle son, a stud starting linebacker for the 6A state championship football team this past fall. He is a highly experienced primary care physician specializing in comprehensive health management for adults and children. He graduated from Notre Dame, and if I didn't tell you that, he probably would have. Every time, Sean. He earned a degree, his medical degree from Loyola Stritch University of Medicine, great institution. He completed his residency in internal medicine and pediatrics at Loyola. He's got 20 years of experience in the western suburbs, serves patients out of Northwestern Memorial and Central DuPage Hospital. As a faculty member of Northwestern's Feinberg School of Medicine, Sean actively teaches medical students and residents, sharing his expertise in chronic disease management, prevention care, weight management, and men's health. He's recognized for his work as an expert witness in medical malpractice cases, underscoring his deep understanding of clinical best practices and patient safety. He lives in the area, as I mentioned, enjoys golf, exercise, reading, and spending time in Lake Geneva. So please give Dr. Cahill a warm welcome. Can somebody do the, like an Otter AI or a recording? Appreciate it.
All right, guys. I want to say thanks to PJ for having me. Like you said, I've been a 15-year resident of Hinsdale, and I got invited to this probably about 13 or so years ago by Ben Jago, if anybody remembers that guy. And I came a few times, and I thought it was really, really hard to get here when I had little kids. And I applaud everybody who's here for being here and paying attention to the stuff that PJ is emphasizing. I invited a bunch of my buddies from Western Springs, and to a man, they all said it's too early. So I don't know if they're too far away or what, but thanks for being here. Also want to say thanks to Nick. I think Nick helped facilitate this a little bit for me too. So I've got a lot to cover today. You can see kind of an agenda on the table. I've given this talk a few times to men's groups, and I think it goes over pretty well. So we're going to talk a little bit about retirement planning, right? So I have 3 apps on my phone that track my money. I have 1 app that tracks my health, and I hardly ever open it. So I wanted to talk about why that is and how we can fix that, okay? And I really want to put some focus on what you should be paying attention to with your health as a guy in their 40s, 50s, or 60s, okay? So, again, a lot to cover. So what do you need to be healthy and happy in retirement? Well, you need your health, you need wealth, right, which is a lot of our focus. And you guys talk a lot in here about good relationships, which I really appreciate. I've since I got invited to this, I started coming back when I can. And I think the emphasis in here on mindfulness and finding joy in moments in your life has been really helpful for me personally. So trying to step back and think about the importance of relationships in your life is super important, especially as we get older. What else do we need? It's the superficial stuff, warmth and sunshine, maybe a house in Florida or Arizona, a boat, a country club, or a tea time. All right. If we have time at the end, I have a bonus 4 slides about the health benefits of golf. This is where I usually put them, but I moved them to the end in case we don't have time, okay? So I hope we get there. So I'm gonna hit you with some hardcore science. This is based on my observation over the past 23 years in medicine. Guys go to the doctor for 2 reasons and 2 reasons only. Their wife or girlfriend made them go. Hopefully not both, right? Keep your stuff together, keep it straight. Who wants you to go to the doctor? There is something wrong with their penis, testicles, or both. That's the other reason guys go. But we can do better, all right? So, that's what we're gonna talk about today. Kevin Custer put together like the summer program, and he knows I like to read, and he knows that I like quotes, and I like wise words. So I'm gonna start off with a couple wise words, and you can pick whatever one is your favorite. I think my favorite's the last one, right? So Peter Attia, in his book Outlive, says the older you are, the healthier you have been. Meaning that every guy in this room was healthier yesterday than today, probably. If you're not, that's an exception to the rule. As we get older, we get less healthy. JFK said, the time to fix the roof is when the sun is shining. I said that to one of my patients yesterday. She sat down, she asked me, should I have this procedure or not? I'm feeling pretty good. And I said, well, the time to fix the roof is when the sun is shining, not when you get into trouble. And finally, a Muhammad Ali quote that I really like, I never won a fight in the ring, I won in my preparation. And that's kind of where my focus is gonna be today. When PJ put this out, and they noticed the last few messages he's put out, he's talking about swing thoughts. So I tried to incorporate that into my presentation today. So this is a swing thought, a time to stop and pause and think, okay, this is important. This is the gist of this talk, right? I mean, everybody in this room is here because they want to be a better dad, a better husband, a better business person. They want to be better to their community, right? A healthy man wants 1,000 things. A sick man wants 1. He wants to be healthy again, right? So everything that you're working towards, retirement, money, and a better business, and a better relationship means very little if you get pancreatic cancer or you get prostate cancer. It kind of puts a different focus on things, right, when you're sick. So what does it mean to be prepared for something? Well, it means to know what's coming at you, right? A plan around what's coming at you, and then finally a way to put that plan in motion. So we're going to apply that today to having a healthy retirement. So doctors love PowerPoints, and doctors love case studies, right? So here's a case study. 48-year-old guy. He's an executive. He's busy. He goes to his doctor visit that his wife made for him, okay? It's a 7-minute annual visit. That is how long the average annual visit to your doctor is. Your physical, right, is 7 minutes long. He gained 20 pounds since last year, so his body mass index is now 34. He's got a blood pressure of 150/90. He's not 18 anymore, if you know what I mean, Doc. Well, I know what you mean. Your stuff isn't working as well as it used to when you were 18, right? He's having a harder time with his erections. That's his kind of nice way of saying it to me. He gets short of breath going up a couple flights of stairs, snores pretty bad. His kids hear him down the hallway. He drinks 2 to 3 drinks a night. I put a couple of asterisks there because in medical school, guys, we are taught to double whatever you tell us. So if you tell me 2 or 3 drinks a night, well, no, 4 to 6. Okay. I did it myself. I went to my doctor last year, right? And he's like, so how's drinking? And I'm like, oh, it's fine. I don't, like 8 a week, 10 a week. All right, it's double. I did it. He says, I'm not exercising much. Doc, I'm busy, man. My knees hurt and I am tired. Okay. So, what are his problems? Then we come up with a problem list in medicine, right? So does any of this sound familiar to any of you guys here? He's obese, and I love in Outlive, Peter Attia's book, he calls it overnourished and undermuscled. I love that euphemism, right? Does he have hypertension? Does he have high blood pressure? Fatigue. So does he have sleep apnea? Okay. He's using alcohol more than he should. So how much is okay? So let's pause for a second. How much is okay? The people that board certify me, the American Board of Internal Medicine, say 14 drinks or less for men, 7 drinks or less for women in a week, right? My wife spit out her rosé when I told her that. So 14 drinks or less is acceptable. Alcohol is a toxin. It's a toxin to your liver. Tylenol is a toxin too, right? But if you take it in the right dose, it doesn't hurt you. It might help your aches and pains or your headache. So alcohol is a toxin, should be used in the right dose. I also encourage all my patients, if you're going to drink, put some water in there too, right? 1 to 1 if you can. Does this guy who's kind of overweight have metabolic syndrome? Meaning he's pre-diabetic, or does he have diabetes? Is his cholesterol bad? We don't know a lot about him yet. That shortness of breath going up a couple flights of stairs, is he just out of shape, or is this a reflection of some heart disease? And then finally, his main issue, what it's all going to boil down to by the end of the visit, is his penis isn't working as well as it used to, and he wants to talk about erectile dysfunction. So, swing thought. What's his retirement going to look like? Okay? He's busy right now, but at some point he's not going to be busy. So is he going to be ripped, walking with his beautiful wife on the beach? Is he going to have to organize his medicines every morning? Is he going to be wheeled into the doctor's office by his wife for his visits? Or is he going to be dead and his wife's new boyfriend's going to be spending his 401k? That's the reality, guys. So pay attention, right?
Dang.
So 3 things we're going to learn today, and we're covering a lot. What's the #1 killer of men and women in the United States, and how can we screen better for it? Number 2, what's the #2 killer of men and women in the United States, and what is out there to screen better for it? Number 3, what's the single best thing we can do to increase our lifespan and health span, and we'll talk about that in a little bit. And then a bonus question, if we get there, Doc, how can my penis work better? In other words, swing thought. Knowledge about what's coming, right? I'm going to tell you why you're probably going to die. Any of us could walk out of here and get hit by a bus today? It's bad luck, right? Taking luck out of the equation, what diseases kill us? A plan centered around that knowledge, right? Some way to control what feels uncontrollable. I'm going to tell you some tests you should do, or at least talk to your doctor about doing. And then finally, putting the plan in motion, right? So training for health retirement. Do those tests and start the process of trying to make yourself a little bit healthier. And again, the goal is progress, not perfection, guys. All right, #1 killer, men and women in the United States, coronary artery disease. So what is coronary artery disease, okay? So it's your heart, big blood vessel coming out of your heart called the aorta. Off of the aorta come blood vessels that dig back into the heart and supply your heart muscle with blood so that it can pump, right? And those, as we get older, those vessels get blocked off and you don't get as much blood flow going to your heart. And then eventually those plaques that develop could break off and float downstream and cause a big heart attack, or block up enough so that it kills a big part of the heart past the blockages. That's what we're looking at. You can read about the risk factors. Age is probably the biggest risk factor, right? As we get older, we get these plaques. Smoking's a risk factor, diabetes, cholesterol, being obese, family history. My dad had a heart attack at 56. It's pretty young, right? Standard screening. Talking to your doctor about your risk factors, right? Family history, getting a cholesterol panel, doing a fasting blood sugar. Is that enough, right? A lot of guys in here probably have done an executive physical, so they stick you on a stress test and tell you whether you have blockages or not, but that's not good enough in my opinion, okay? So we'll talk about why here in a second. I think us in the medical community, we're really good at waiting for you to have your heart attack and then saying, oh man, let's get you on an aspirin now. Let's get you on some blood pressure medicine. Let's get you on a cholesterol medicine. But we can do better. We can help prevent some of these things, okay? So, better screening. There's some blood tests out there you guys, when you go to your doctor, should think about getting. There's a couple advanced cholesterol tests, lipoprotein little a and apolipoprotein B, okay? Lipoprotein little a is a screen for early heart disease. Early heart disease. So, you know, my patient comes in, they're 80, I might not get a lipoprotein little a, but somebody who's 40, and they tell me, man, my dad had a heart attack at 60, like, okay, this guy deserves a lipoprotein little a. It's a one-time test to screen for your risk for early heart disease. There is no way to treat it right now, but there is a medicine in the pipeline, hopefully coming out this year, that would target a really high lipoprotein little a. Apolipoprotein B is more reflective of your bad cholesterol than your traditional bad cholesterol, the LDL. So apolipoprotein B is something that if you have high cholesterol, your doctor should be testing for. It's a more accurate measure of what your bad cholesterol really is, and it's treatable with a statin and some of those traditional cholesterol medicines, okay? So when you go on one of those medicines, you should see your LDL reduce, but you should also see your apolipoprotein B reduce. 50% of people who have a heart attack have a normal lipid panel. So we're missing something, right? These cholesterols are a better reflection of what your overall cholesterol panel is, it looks like, and what your risk is. But you should be thinking, or at least talk to your doctor about getting some inflammatory markers, right? So cholesterol has been villainized over the years. It really has been thrown under the bus as the sole reason that people have heart disease. And it's not. There's some inflammatory pathways that are really poorly understood. A few years ago, it became really in vogue for your doctor to check a CRP, for example, a C-reactive protein. And then it became out of vogue, and now we're swinging back to checking those and other inflammatory markers and really thinking hard about the role of inflammation in the development of heart disease, okay? So talk to your doctor about getting some inflammatory markers and what they think about that. It's kind of controversial right now, but I think it's a good conversation. These other cholesterols are really good to talk to your doctor about. All right, better than that is some sort of heart imaging. So a couple weeks ago, right before you guys took a break from this, I was at a session and PJ was up here starting to talk about CT calcium scores. I'm like, dude, what's stealing my mojo? Like, that's one of the things, that's one of the main things, right? If you're gonna take one thing away from this talk here today, if you haven't had a CT calcium score, go get one. It's a cheap test, 50 bucks, 60 bucks. You can self-refer, right? You could go over to Hinsdale Hospital, you could go over to Good Sam. I did mine at Good Samaritan Hospital. It cost me $49. They swiped my credit card. It's literally a 5-minute CT scan of your coronary arteries, no contrast, and it might save your life, okay? What it's looking at is calcium deposits in plaques that have been damaged, right? It's kind of like potholes in the wintertime that develop in our Hinsdale streets, okay? And then somebody in the street crew comes in the spring and fills those in. This is screening for the fill-ins, right? Your body's fill-in process is putting calcium into cracked plaques. So that's what the CT looks at. It is not a perfect test, okay? About 15% of people who have a CT calcium score of 0 still have heart disease. It sees one type of plaque, and there's three types of plaques, and this sees the one with calcium in it. About 2 to 3% of people that have a CT calcium score of 0 will have significant heart disease. So I don't hang my hat entirely on this test, but I think for 50 or 60 or 70 bucks, it's a really great place to start.
So okay. Sean, my executive assistant, last time I sent out notes on that, maybe 4 or 5 years ago, she was like, oh, I've never had that done. My brother just had a heart attack. She was 55 years old. She went for her scan, and they're like, wow, you need to go see a cardiologist right away.
Yep.
She's 55, totally healthy, and she had 90% blockage in one of her major arteries.
Yep.
And she got stents and she's fine, but they're like, you would have had a massive heart attack within the next 10 years.
Within the next probably 3 years.
Yeah.
You know, so sure. I mean, I can tell you story after story after story like that. You know, since I opened my own concierge practice, I've ordered probably, 30 of these relatively recently, and I'd say 25 to 30% come back with some pretty significant heart disease. And then you have to do further testing, right? So what's the further testing? CT angiogram is a nice next step. There's something called FFR, which is free flow residual. It tells you how much blood flow is actually getting past the blockages, and if there's any kind of ischemia that you're experiencing, meaning you're not getting enough blood flow to the muscle. There's a new company, a relatively new company out there called Clearly. You can pay cash and get a better test. It's $1,600 to do a Clearly scan, but it's gonna be way better coronary artery imaging that's AI assisted. Stress test, guys, it's important to understand. Stress test answers a different question, okay? So we talked about our executive physical, walking on a treadmill or doing a chemical stress test. That tells you, do you have blockages that are bad enough that you're not able to get blood flow to the muscle past it? That's the question, right? That it's answering. A CT calcium score is answering the question, do I have blockages? And I think that's an important question we don't pay enough attention to. Not are those blockages bad enough that I'm gonna have a heart attack, but do I have blockages? Because the blockages over time are gonna get worse. They're gonna grow. Usually you need about a 70% blockage to really feel symptoms from coronary artery disease, okay? So who here knows their anatomy? This is my anatomy, okay? So, Dan had a heart attack at 56. He lived a different life than I did. He was a smoker, never exercised, he was an electrician, like manual labor electrician. So every day he packed a lunch, he would take Braunschweiger. I don't know if anybody knows what Braunschweiger is, but it's absolutely disgusting liver pate that you cut a block off and put it between some Wonder Bread. Not very healthy, I guess is what I'm trying to say. So, we're part genes, right? 20% genetics and 80% lifestyle, I guess is what I'd say. So the 20% genetics I got from my dad, I said, okay, he's 56, I had a heart attack. I'm gonna have my CT calcium score done. So I did, and it was 240. So just in the context, right? 0 is awesome. Less than 100's a little bit of plaque. 100 to 300's moderate plaque, right? And then over 300's more plaque than you should probably have. And it's all kind of graded on your age as well, right? So 240 for me at my age was too high. So I started an aspirin and a statin and a blood pressure medicine. I went on this quest of losing weight, and I've lost a lot of weight. I remain a work in progress, and it's part of how I'm here in front of you guys today is to say, we as physicians sometimes are intimidating, right? You walk in and we're coming down on you about how perfect you should be and how this is what we want you to do, but we're people too, right? So this was a big wake-up call for me. And this is my anatomy. So this is from my CT angiogram with free flow residual, so FFR. So this is my aorta, right? So big blood vessel coming out of the heart. And then these are my blood vessels that come off of the aorta and again, dig back into heart muscle and supply the heart muscle with blood flow. So you can see my CT calcium score was 240, but it all comes right at the end of my left anterior descending artery. It's 13% blocked, way down at the end of like one of the main blood vessels. So at the end of the day, this was really not a big deal, but was a big wake-up call for me personally, right? So I would encourage all you guys to go get a CT calcium score, if it's high, to go do this test, or go do a test, either this or Clearly, to get a better hold on what your coronary artery anatomy looks like.
How often?
Boy, great question. Every 3 to 5 years, especially if you have a good score, like less than 100, every 3 to 5 years, you can kind of follow the progression. Fantastic question.
What's the name of that test?
CT calcium score. CT calcium score.
So if you're below 100, you go 3 to 5 years?
Yeah, every 3 to 5 years.
And if you've been put on a statin after getting CT scan, do you need to rescan?
No, 3 to 5 years. So what statins do, that's a tricky question. That's a really intricate question, right? Because what a statin's going to do to somebody who has coronary artery disease is going to create more calcified plaques. Because it's an so it's helping to go into those coronary arteries and pave the damaged ones over. So you can actually see an increase in the CT calcium score in somebody who's on a statin. So subtle difference, but great question. So coming back to my next swing thought, right? So this guy, our case study, he's 48. He's in there. His wife's worried about him having a heart attack. His wife sees he gained 20 pounds. His wife's worried that he snores. His wife's worried that he's short of breath going upstairs. But he's worried about his penis, right? He's like, man, I'm not 18 anymore. Let's put our focus where it's supposed to be, right? So, anyway, can you give me a little Cialis, right? I tell you, this is what guys come into the doctor for, I swear to God. So, this is our swing thought for the day. How do erections work, right? Well, they are your nature's scorecard for your circulation, your hormone balance, and your mental health, right? It all wraps up into one, and then you either get a good heart on or you don't, right? If any part of that process fails, you're doomed, right? If you're sitting there thinking about how good's my erection going to be tonight, it's probably not going to be really good, right? So you need good blood flow in the small arteries to the penis, called the bulbar cavernosus. To point, you need a good parasympathetic nervous system, and then to shoot, you need a good sympathetic nervous system. So it's all got to kind of come together, right? It's mental health, it's blood flow, it's your nerves. And your nerves are dependent on blood flow too, right? Your nerves are supplied by little tiny blood vessels as well. So if those are diseased, the whole process isn't going to work as well. So if you have bad erections, and I'm not saying anybody here does, but if you do, your body might be trying to tell you something. It might, okay? So 30 million men in the United States experience erectile dysfunction. But it's often the first sign of heart disease, diabetes, or high blood pressure. So I know when you guys come to see me, your concern is, dude, I need some Cialis. I need this to work better. My concern should also be, all right, let's get you on some Cialis. Let's make it work better for you. But my concern should also be, have you had any heart screening? When was the last time you had some labs looking at your blood sugar? When was the last time anybody addressed your blood pressure with you? Okay? So, lots of stats on this slide. But I think the one that really struck to me was that men with erectile dysfunction are 45% more likely to experience a significant cardiovascular event in the next 9 years than men who don't have erectile dysfunction. So if you're sitting there, things aren't working like they used to, go to your doctor and talk it out, especially about cardiovascular screening. All right, so if you have erectile dysfunction, fix the cause, and hopefully performance follows. Get your heart checked, lower your blood pressure, manage your diabetes, reduce your stress, improve your sleep, do all those things we tell you to do. Get in better shape. I love this slide. Dr. Lewis saved my life. 4 stars. I freaking hate that you guys could rate me. I don't care. If you walk into my office and you want 120 Norco tablets and I tell you no, I'm gonna give this guy 1 star. He's a dick. No, I'm doing what I think is right for your health. Okay? So I love this. Dr. Lewis saved my life. 4 stars. Dr. Lewis replies, honestly, I don't know how to earn that 5th star. Right? They don't. All right. Questions, comments, concerns. You guys asked some great questions. We are pressed for time, so I'm going to move on. The next thing that's going to kill you, if heart disease doesn't get you, cancer is going to get you, right? So, risk factors, you can read about them. Age, smoking, obesity. Obesity is tied with smoking for a risk factor for cancer now, guys. It is
What is the definition of obesity?
Wow, great. We still use body mass index a lot. Body mass index falls apart if, let's say, you are Ezekiel Elliott or some sort of elite athlete, like an elite running back who's 5'7", 205 pounds. He's got a body fat of 6%. The guy takes his shirt off, and you can see like that guy. He's not obese, right? He's got a body mass index of probably 33. I would have to do the math. So he would be technically obese. He's not. But for the vast majority of us who walk into the doctor's office, it's a really good, cheap, easy measurement to screen for obesity.
And BMI over what, is it 25%?
BMI, it depends by country, but in the United States, over 27 is a little overweight. 30 to 35 is mild obesity, 35 to 40 is moderate obesity, and over 40 is severe obesity. So great question. Over 40, should be thinking about going to a surgeon and maybe getting a surgical procedure to try to lose weight. Those other ones, we try some medicines to try to help you, right? Like the GLP-1s. So, standard cancer screening is very dependent on what your insurance allows and what science has said is the things to screen for, right? So but it's very cost related. I want you guys to understand that, right? So it's based on populations of people. So when we look at every guy in the United States, 50 and up, okay, colonoscopy, yes, you should all get a colonoscopy, right? Everybody should have a PSA for the reasons that PJ spoke about. PSA, it's interesting, right? 0.4 to 4 is normal. So if you just look at one, it's not that reliable. But if you look at one a year or every couple of years over the course of time, you see something called the rate of rise, right? So let's say my PSA is 3.9 and it goes up to 4.1. So it went from normal to abnormal. Is that more concerning, or is somebody who goes from 1 to 3.5 more concerning? I'd say that 1 to 3.5 is more concerning. That's a big jump, right? So your doctor needs to interpret that data over time. So, skin cancer screening, we forget about that one all the time. Everybody in here should have a dermatologist and go see him once a year and wear some sunscreen, right? Again, this is another case where modern medicine, Western medicine, how I'm trained, we are really good at waiting for you to have your bad cancer and then saying, oops, all right, we didn't know. Let's do something about it now, right? We got surgery, we got chemo, we got radiation, we got all sorts of stuff that your insurance may or may not cover. There's better screening out there, and that's one of the big things I want to talk to you guys about today is better cancer screening. So, there's imaging. So similar to CT calcium score, there is whole body MRI now. So, it's costly, right? And you pay for what you get, right? So the leader in the industry is Prenuvo. Their founder was the first guy who kind of came up with this. There was a radiologist doing this in Canada, kind of rogue. People could come in and pay for an MRI of their entire body. And this guy heard about it, went up there and visited them and talked them into creating this company, Prenuvo. And now a lot of other companies have kind of latched on to the concept and offer kind of have undercut the price, but you get less. I'll be honest with you, Prenuvo has really nice MRI machines. They have radiologists that are trained in whole body MRI, so it's not a piecemeal reading, it's a reading of your whole body. So it's controversial. I think everybody going into a whole body MRI needs to know they're gonna find imperfections, okay? There's none of us in here who don't have some cysts somewhere or don't have something that's wrong. So don't expect a perfect report, because there is no perfect report. It picks up a gain changer about 3% to 5% of the time. The main cancers it's going to pick up, for example, thyroid, pancreas, ovary, things that we don't have screening for right now.
So the Prenuvo did not pick up, it won't pick up the prostate cancer.
It could. It could. So you could have lumps.
That would be metastatic then.
No.
No.
It can take one of the organs it looks at is your prostate, and it will, like, for me, I had my Prenuvo, and it said my prostate's a normal size, and there's no nodules on it.
So for mine, when I did have prostate cancer, it did not pick it up. But a buddy of mine's brother who had pancreatic cancer, stage 1 was detected, and he's still alive because of it. You typically don't find it until you have symptoms, and by that time, it's typically stage 4.
Yes, 100% I'll agree. So there was Prenuvo had a night to come learn more about the company, and those of us who've actually done the scan could come talk about our personal experience with the scan. And I was invited to that. I got to talk. I was the first person. I thought I had a really great story about my Prenuvo scan. And then a physician got up, the last one to talk, and he said, well, I was really skeptical of this thing. He's like a 60-year-old guy. And he said, I was really skeptical of this thing, but fine, I'll do this scan. And found my stage 1 pancreatic cancer. I had a Whipple, and now I'm cancer-free. And I was like, well, shit, that just made my story look cool. I had a thyroid nodule, right? And I thought I was cool. Another speaker at that same talk, that's how she discovered her thyroid cancer. So the average person, it's important to know, does have 2 significant findings that warrant follow-up medical attention, right? So you might have some extra doctor visits that come from your Prenuvo scan. So it becomes a bit of a slippery slope. The whole body MRI, the radiologist interpreting it, use AI, and they're supposed to be pretty black and white about what's concerning and what's not concerning. So that's one of the things I like about Prenuvo in particular, is they tell you, okay, this is concerning, this warrants follow-up, or this isn't really a big deal. Don't worry so much about this, okay? They also have scans, their baseline scan screens for aneurysms too, which is pretty cool. Their upgraded scans can now screen for early Alzheimer's changes in your brain and can do bone density and body composition. They are working on, and it's proprietary info that I'm giving you right now, but they are working on a way to look at your coronary arteries with MRI. Doesn't work as well yet, but they're trying to figure out a way to do it, because this would be the perfect scan. It really would be, like the perfect screening tool if you could somehow build in coronary artery disease. So here's mine. 2 significant findings that warranted follow-up attention. I had these little ditzels in my brain. I have this like familial tremor, so when my wife saw these 2 ditzels on my report and then noticed I had this tremor that my dad had, she's like, you gotta go to a neurologist. I'm like, all right, great. So I text my buddy who's a neurologist, says, hey, can I come see you? He does a lot of MS work and stuff. He says, sure, so I get in like 3 days later, because, that doctors do that with other doctors. Take you guys 4 months to get in and see someone. He takes one look at this and he says, oh, do you have migraines? And I say, yeah, I get some rip-roaring headaches. My sister has migraines. My mom had migraines. He says, oh, those little ditzels are from migraines. Don't worry about it. Anyway, best case scenario. And then the red circle there, that's my thyroid. I had a big nodule on the left side of my thyroid, so I had to have that biopsied. Luckily not cancer, but I have to have another ultrasound of it in a year. All right. Continuing on, better cancer screening. There's multi-cancer early detection blood tests. Gallery's the most popular, but there's a lot of competitors coming out now. So it's blood work. They take your blood, they test it for dead cancer cell DNA floating around in your bloodstream. It costs about $850. You can do it every couple of years, probably a good idea. It's getting very popular. So Cologuard, everybody's heard of Cologuard? Exact Sciences that owns Cologuard just developed CancerGuard, and they're launching that, right? And it screens for 30-something different cancers. Well, Gallery screens for 50. I think it's a better test, but it is what it is. Can screen for pancreatic cancer, ovarian cancer, liver cancer, okay? There's genetic testing as well. So OpenDNA is the company we use, and it gives you your genetic risk for not only heart disease, diabetes, but also many, many different types of cancers, even Alzheimer's, bipolar disease. So you're analyzing thousands of genes to screen for cancers and other diseases that concern us.
And I've talked to a number of people, and myself, every other year, I'll do a Prenuvo, and I'll do the Grail the next year.
Yeah, I think that's a great approach. I talk to my patients a lot about that. It's easy for me to spend your money, right? Prenuvo is $2,500 or $2,400. Gallery is $850. Man, it can all add up really fast. But if you kind of rotate years, I think that's a really nice approach. So, I told you what's going to kill you, right? Heart disease and cancer. I gave you some tests to do. Now, what can you do to influence your health on a daily basis? So anybody who's read Peter Attia's book, Outlive, he talks a lot about Healthspan and lifespan. The lifespan's a number, right? How long are you going to live? The United States, 80-ish, right? Most people, when they're pressing up against 80, it doesn't look pretty anymore, right? So they have what he termed the marginal decade, meaning like those last 10 years of your life, you're running up against your health. It's really causing a lot of slowdown and a lot of problems. You're not able to do the things you want to do. I think so many people plan to get to retirement, they're gonna travel, they're gonna do this, they're gonna do that. And it becomes, their health just gets in the way of all their grand plans, right? They can't do the things they want to do anymore. So, you know, my ideal death, walking off the 18th green in Augusta, I just shot my age, and I just keel over and die in front of my buddies, right? But most of us aren't that lucky, we just suffer, right? I encourage patients all the time, look at your parents. What kind of shape are they in? What kind of health are they in? They might be a really good reflection of where you're gonna be when you're their age. Both my parents are dead, so not great, right? So how do you lengthen your health span? How do you lengthen your lifespan? How do you try to get them to match up? There's 4 pillars of health, and I think physicians don't emphasize this enough to you guys, okay? Nutrition, exercise, sleep, and mental health. So what did I learn about in med school? Mental health stuff. I mean, I certainly did a rotation in that. But we don't get much training in how to eat, how to exercise. We don't get a lot of training in sleep health, right? Sleep hygiene. All of them are important, but the most important is the one I don't have anything written about up here. It's exercise. That's how we kind of push our health towards how long we're gonna live, right? And make them match up better, okay? So everybody understands that concept, right? If you're gonna live to 80, I would love to live to 80, if that's all I got, and I just wanna keel over and die, right? I wanna be with my grandkids, I wanna be walking the beach, I wanna be traveling, and then boom, I just go. That would be ideal, rather than living to 80, but 70 starts to suck, right? So I can move that needle by exercising more. And there's really 4 ways to exercise, or things to think about when you're exercising. I think a lot of people are in a zone 2 training, which is breathless exercise. It's great. It's kind of the foundation of our fitness. Or there's VO2 max, like could you outrun a cheetah for a few seconds? That's kind of what a VO2 max is talking about. I think muscle, I've always undersold. I think being muscular is like one of the best commodities you can have because you're gonna spend it in old age. We lose about 1% a year of our musculature over the age of 40. So you gotta work to prevent that. You gotta work to maintain your muscle. And the other thing we don't give enough thought to as we get older is maintaining our balance, right? So it's important to be able to catch yourself. So like I go to Orange Theory. I go twice a week religiously for the past probably 7 or 8 years. And I was, all years ago, I was like, why do they make me do all this shit on one foot, right? And like I'm doing curls on one foot or deadlifts on one foot. I'm like, why do they do that? And then it clicked for me one day. I was like, oh, so I don't fall. I'm training my balance system. I'm training my brain to think about my foot grabbing the floor and maintaining like where I'm at in space. I'm better at that now than I used to be. Oh, I get that. So swing thoughts, right? Determine how much time you can devote to exercise and then do it. I know you're busy, like you're a case study guy, right? But 150 minutes a week is kind of your bare minimum goal, okay, for movement. What are your goals? What do you want to get out of it, right? Do you want to look better? It's a fine goal, right? But think about if you're 50 now and you want to be able to pick up your grandkid when you're 75, well, if you can't do a 50-pound goblet squat now, how are you going to pick up your 30-pound grandkid in 25 years? It's not going to work well for you. You have to be thinking, what's your goals? Is your goal to get your luggage up over your head on an airplane? It was easy for me this past weekend, but it might not be so easy when I'm 75 or 80. What are your goals? Walk on the beach, walk 18 holes of golf, have sex, play pickleball? What's your goals? Don't get hurt, right? I like when people work with trainers. It's one of the things I like a lot about Orange Theory is the fact that I'm kind of guided in what I do. I get people to physical therapy all the time for their orthopedic issues. I think having a good physical therapist is important. Exercise is the perfect medicine as we age, right? It reduces your cardiovascular risk, reduces cancer risk, releases endorphins that help lower your stress and your cortisol, and improves sleep, improves anxiety and depression, and is essentially training for retirement. So back to our case study guide. So he's frustrated, his corporate doctor seems rushed and doesn't listen well. He waited 6 months for that 7-minute visit. He's worried about his erections, his wife's worried about having a heart attack. They're both important, right? So we have time to figure that out in a concierge visit, right? So his doctor fixes a few things, says you gotta exercise more, you gotta lose some weight, maybe puts him on a GLP-1 medicine to help him lose a little bit of weight, emphasizes the importance of exercise and thinking about goal setting, decreasing his alcohol, and a year later he's ripped now, at least a little bit. Blood pressure's better, he sleeps better, CT calcium score was 0, whole body MRI looks great, and most importantly his erections got a little bit better.
In whose opinion?
His. That's the only one that matters. In life, you guys, you don't rise to the level of your expectation, you fall to the level of your preparation, right? You fall to the level of your preparation. So coming back to the Muhammad Ali quote, it's true as a husband and dad, it's true as a business owner, it's true with your spirituality, right? It's also true with your health. You rise to the level of your preparation. Or you fall to the level of preparation, I'm sorry. Words nobody ever said on their deathbed was, man, I'm too fit, my balance is too good, or I have too much muscle. Remember, muscle is the organ of longevity, and a healthy man wants 1,000 things, and a sick man only wants one. So what did we learn today? Number one killer, men and women. United States, coronary artery disease. What test should we get? CT calcium score. I would add to that lipoprotein little a and an apolipoprotein B, and think about inflammatory markers. Number two killer, cancer. What can we do? Whole body MRI, multi-cancer early detection blood testing, or DNA testing to see what you're at risk for in your genetics. What's the single best way to increase lifespan and health span? Exercise. Bonus question, how can my penis work better? Get in better shape and address your medical issues, right? Be proactive. Set goals and train. So my goals, personally, that's my family. I want a fit body. It's a work in progress, sometimes better than others. I want a sound mind. I want a house full of love. I want to walk on the beach at 80 with my kids, and wife, and grandkids. And I want to travel and play a little golf. I hope everybody learned something. I certainly like giving this talk. It's the biggest crowd I've given this talk to. I like when it's a little interactive. This has been, it's been hard, like as far as interactivity goes, but you guys asked a couple really good questions. I think my final swing thought is eat half, walk double, laugh triple, and love with no measure. What questions, comments, concerns do you guys have? I know we're pressing up against time pretty hard.
You were gonna talk about golf.
Yeah.
Question?
I was just gonna ask the whole body MRI, how long was that test?
1 hour.
1 hour.
It's 1 hard hour, okay? Like if you're claustrophobic, it's not the thing for you. Or you should be heavily medicated.
Can they do the open?
No, you're in the tube, right? You're in the chamber. So I did it. I've never had an
They play
MRI.
a show for you. They keep
I've never had an MRI before, right? So here I go to Pernuvo. It's beautiful. They got nice looking people checking you in. They got great snacks, and beverages, and stuff. You think you're in a spa. And you walk back to the MRI, they kind of strap you in, and you have a panic button, and I'm like, what do I need a panic button for? He's like, well, you'll see. I'm like, okay. So they strap your head in with this contraption, right? You can, there's mirror on your, like mirrored goggles where you can watch a Netflix show behind you on the screen. So that's kind of cool, and you can listen to music instead, but you have speakers here. And they put this weighted blanket on you so you're not moving around much. And then this MRI machine is like any MRI machine. It's big, it's noisy, right? It's swirling around you. You're chunk, 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 chunk. The thing that I was most struck about was that I got these hot flashes while I was in it. I don't know if you got hot flashes, but I felt like hot sometimes. So I come out and I'm like, hey, why did I get like these hot flashes? And they said, well, it's such a long MRI that the magnets are bending and twisting your cells that it releases heat. And some people like get a hot flash from that. I'm like, great, I'm glad I'm not going through menopause.
I said a quick one. Family history, if you have that for either colonoscopy or the PSA. Rule of thumb on like how much to pull in from 45
So rule of thumb for like when you, so the question was, if you have a family history of colon cancer or prostate cancer, what's the rule of thumb for initiating screening? Is that right? So rule of thumb is regular age or 10 years before your first degree relative had that disease. So dad had colon cancer at 55, you should be starting your screening at least at 45, right? There's a push to screen 40 and up. Let's say dad had prostate cancer at 50, you'd want to start your PSA testing 40. So, general rule of thumb.
The PSA is just in your normal blood test, you just have to ask them to include it.
You shouldn't have to ask to include it. Any guy who's
I
going
would
to
just
doctor.
make sure
Yeah.
that your doctor is including it.
Yeah.
Because I've heard that some people are saying it's not important. It's incredible that I hear that.
It's a, PJ's right, it's a highly controversial test, to be honest, because what a lot of people say, well, if you ride a bike, your PSA gets elevated. Or, vigorous exercise will elevate your PSA. Well, so will prostate cancer, right? And especially 50 to 65 is kind of that target audience for prostate cancer. You know, if your dad's 79 and gets prostate cancer, if all of us live to 79, most of us are gonna get prostate cancer. The prostate becomes cancerous the older we get, okay? You will get prostate cancer if you live to 100, almost certainly. The age that we really want to detect prostate cancer is 50 to 65 because it is more likely to travel, it's more likely to be an awful disease for you than if you're 79 and you discover it. You're much more likely to die of something else than you are prostate cancer.
What they told me is that we can get you 15 years if it leaves the prostate. But if you can take out the prostate, then you're cancer free.
All right,
Cool, thank you.
4 slides on golf, really quick. Oh, go ahead.
Yeah, thoughts on peptide therapy, and do you put it in your retirement plan?
Oh man, peptide therapy. What's a peptide? So peptide is a protein that's less than 20 or less amino acid protein. We have thousands of those coursing through our bloodstream at all times, acting as hormones and helping our body function. GLP-1s, so your Mounjaros and Wegovy's, those are peptides that help people lose weight. I think the peptides you're talking about are like BPC 157 and some of these other peptides that are out there. These infusion centers are popping up saying, we'll give you some peptides to help your recovery or help you feel more energetic or help you feel better. That's the wild west of medicine right now. I think eventually it might get there where there's some regulation and there's some standardization, but there is not. So I think you're really dependent on trusting a compounding pharmacy who's making that, trusting that the infusion clinic you're going to is buying a good product. And there isn't a lot of hardcore science behind peptides yet, but I know a lot of research is being done. I get asked that question all the time about peptides. So I use peptides in my practice, right? The GLP-1s are peptides. The Wegovy's and Mounjaros, those weight loss medicines, semaglutide or tirzepatide, they are peptides. All right, 4 quick slides on golf, and then we gotta get to breakfast if we have time.
Yeah.
We okay? All right. Golfers live longer. This is science. 4.5 minutes longer for every hour of golf. There's a massive study of 300,000 golfers who found that people who golf regularly live 5 years longer than non-golfers.
Where's Britt Lee?
Every swing, calculation, and putt. Yeah, this is the ones you're going to want to take pictures of and show your wife. What are we talking about? You know, golf course for, honey. All right. You got to walk. You got to avoid too many beverages. It's a magic triad of light aerobics, balance training, and social interaction. Lowers your blood pressure. Cuts heart disease risk by up to 30%, guys. You have a 27% lower risk of Alzheimer's disease compared to non-players. Vitamin D that you're getting in the sunlight supports your immune system and bone health. Apply sunscreen on the 4th hole. So when I golf, I usually golf without sunscreen for 3 holes, get a little bit of sunlight, and then my fair Irish skin that's had a little cancer last year has to get some sunscreen on it. Lowers your cortisol, should relieve stress, not increase it, so you gotta remember you're not on tour. All right? It's not just a game, it's medicine for your brain, heart, muscles, bones, balance, and mood. A few rounds a month can add years to your life. That's important information. Go talk to your wife about those things.
Hey, hey.